Hi, everyone. Welcome to the Lakeview podcast series. I'm pleased today to be joined with Ben McCoy, Director of Operations, and Chris Dreisbach, founder and CEO of Blueprints Recovery in Elizabethtown, Pennsylvania. Did I just massacre your last name, Chris?
Only a little.
Oh,
Only a little.
Well, we'll make sure that we do it correctly towards the end so everybody actually knows how to get in touch with you.
Right.
It's really good to have you here in Jacksonville, and we're excited to hear more about your program. Before we get into the specifics, though, Chris, I'm curious to hear more about what prompted you to open Blueprints.
Well, I had sat down with Ben over a cigar, and I'd actually asked Ben to help me with a website because he is a tremendous website builder. And over the course of our discussion, I kind of talked to him about a vision of being able to provide high-quality treatment to everybody, regardless of their payment funding source. Over the course of our cigar, probably about halfway through the cigar, Ben was sold on the idea, and he really invested his whole heart into it, and we launched out on fleshing out a program that Ben can talk a little bit more about to be able to give that level of care to everybody.
And so, how old are you guys right now?
How old are we?
Our organization, 3 or 4 months.
3 or 4 months? Okay, great. So tell us a little bit about it.
It all blurs together for me. I mean, he and I have been working on it for long before.
Yeah.
I think we were licensed and operating
4 months
early
ago.
May.
Oh, okay.
Yeah.
And so you guys actually opened your doors right
May
before
1.
summer, maybe?
Yes.
Okay, great. So tell us about your program.
We are young. We are partial hospitalization, intensive outpatient, and continuing outpatient counseling services, primary drug and alcohol. Our medical, and obviously there's a certain degree of comorbidity in anybody that comes in for mental health or behavioral health care or drug and alcohol. And our medical director is a psychiatrist, so he's kind of the gatekeeper on any cases that, have co-occurring diagnoses that are a little out of our depth, but we wanted to have a classic work with people, primary drug and alcohol, and we wanted to really flesh out our program as phases 2 and 3 and on in continuing care, because my background is in inpatient drug and alcohol treatment, and I kind of observed professionally, and this was a large part of the conversation Chris and I had in the beginning, is we see a breakdown in kind of the integrity of programs, continuing care programs, or a breakdown in a really cohesive vision. I mean, that's why we're down here. That's why we met with Mandy and Jen, because we're doing our best to find and develop relationships with programs that have real holistic and systemic integrity, and show up and connect the dots for them so that we can talk to their aftercare people and coordinate sober and transitional living, connect the dots, get them to our place, do an eval. We do transportation back and forth for all of our levels of care. And we did everything we could, and it's constantly an ongoing, evolving process to take our outpatient treatment day and turn it into something of a real bridge from an integrated inpatient model. So instead of, forgive me, but instead of there's a lot of day treatment programs that are a 5-hour process group and a worksheet from 1975. So we took our time and got together our clinical team and spent a lot of time fleshing out a day treatment program Monday through Friday, 9 to 2:30, that's got objective-driven discussion and process group, skills training and dialectical behavioral therapy, psychoeducation. We have contracted outside practitioners that come in, or we take people off-site to do different experiential, holistic activities, all within that less restrictive environment where in the afternoon we take them back to whatever their sober transitional living is, and they are able to better integrate into the recovery community, into their families, and into a professional role. We have intensive outpatient, daytime and evening, Monday, Wednesday, and Friday. And actually evening is Monday, Wednesday, and Thursday. But even that, we've been able to add psychoeducation and skills training components to it in a more experiential capacity, as well as the traditional process group that is really the substance of an IOP. And that's what we do, and we're always growing and changing.
It's nice to hear that you guys are creating this long-term impact, not just in regards to acute care, which is very often the case with residential treatment, but to really try to extend this recovery experience, that it's much, much more, especially that first year post-treatment, which is so volatile. So what you guys are doing is you're creating that safety net that's so critical for our patients.
I mean, all the data, all the evidence is continuing care. I mean, it's just one of the few really simple truths that we have when we're in the fight against addiction, is that the more engaged and the longer I'm engaged, the better the outcomes.
Absolutely. Well, it sounds like you guys have a great platform, and there's so much more to hear about your program as it continues to evolve. If someone were interested in accessing services in Elizabethtown to work with you guys, how could they get in touch with you?
Well, first, let me tell you that our referral process is very simple. You just call our main office line. You're always going to get a live human being 24 hours a day, 7 days a week at 717-361-1660. And you can also visit our website at blueprintsrecovery.com and come reach out to us. We'd love to have you stop by. We'd love to talk to you more about the program and send anybody any information that they'd like.
Well, very good. Well, thank you, Ben and Chris, for taking the time to come to Jacksonville and tell us about your program. For those of you that are interested in learning more about Lakeview Health, we invite you to visit us at lakeviewhealth.com. If you know someone who needs access to residential treatment right away, please give us a call at 866-887-0142.